Great. So the webinar is currently being recorded, and again, that's for those partners that weren't able to join us on the live call today. Again, thank you for joining us for the first National Latino AIDS Awareness Day 2014 network call on today, May 28th, 2014. Some general housekeeping rules. The lines are all currently muted, just to eliminate some of the background noise. Sometimes when we have the lines unmuted, it gets kind of difficult to hear. If at any point you want to go ahead and unmute your line or talk, you can do so by pressing *7, and you can mute your line again by pressing *6. So again, that's *7 to talk, and it's *6 to mute your line again. At any point, you can go ahead and make a comment or pose a question in the chat box using your keyboard on the screen, and I'll make sure to try to get to your question or comment while we're going through the webinar. And at the end, you'll notice that we do an evaluation, a quick evaluation form, just to get your input on what we covered during today's discussion. And these are very important because we really want to make sure that these are beneficial to our partners that are dialing in and getting the information that they want, or give us some insight on what information they think might be useful so that we can present that at a later time or bring it up as a discussion point. So I encourage you all to complete that evaluation form, and you'll be redirected to that evaluation form once the webinar is over. So a screen will pop up on your screen where you'll be able to fill that out. So please take the time to fill that out. That's very, very useful for us to make sure that we provide you all with the tools that you need. All right. Again, this is the general agenda of what we'll be covering today. We'll do a quick introduction, let you guys know who we are, who I am, and also get a chance to hear who's on the call with us. After that, we'll go into a quick introduction of what NLAAD is and a brief history for those partners that are joining us for the first time today. And then we'll follow up with the meat of the discussion, which is kind of the highlights of 2013. So we produce a report from year to year, which summarizes how the campaign did throughout the country. And we produce a report that we want to make sure that we present to you all so you guys can kind of see the great work that we're all doing as a team, as in a collaborative effort across the country in raising awareness amongst the Latino community. After that, we'll go ahead and do a quick question and answer session and open the lines up for you guys to make general comments or pose general questions and really hear anything you guys want to say about the information that's presented. And finally, we'll do a quick announcements and general information that we'll discuss as far as subsequent or following things that we'll be doing for the implementation and planning of National Latino AIDS Awareness Day. Again, my name is Tony Ochoa. I'm with the Capacity Building Assistance Division, and I'm also the Program Manager for National Latino AIDS Awareness Day. So I thank you guys all for joining us this afternoon. What I'm going to do right now is I'm going to go ahead and unmute the lines. And if you can, go ahead and just let us know, give us your name, let us know what group you're with or what agency you're with, and we'll go from there, okay? So your name, your agency, and I guess your city, where you're located. So I'm going to go ahead and unmute the lines now.
The conference has been unmuted.
So again, my name is Tony Ochoa. I'm with the Latino Commission on AIDS. I'm the Program Manager for National Latino AIDS Awareness Day. And we're based here in New York City, so go ahead and either answer your response in the chat box or go ahead and speak out and let us know you're on the line.
Sandra Estevez, Florida Department of Health, Florida.
Sandra, how are you?
Fine, and you?
Good.
Hello, Elvira Aguirre, Mexican Consulate, Ventanilla de Salud, Little Rock, Arkansas.
Hi, Elvira.
My name is Sue Espinosa, Arkansas Human Development Corporation in Little Rock, Arkansas.
Hi, Sue.
Hi.
Hi,
Hello?
Roxana Olivas from Washington, D.C., Office of Latino Affairs.
Wonderful. Welcome.
Hi, hello, this is Dennis Escobar from Carolina Care Partnership in North Carolina. Hi, Tony.
Hey, Dennis.
How are you?
Good.
Hi, Erica Cuello with the Florida Department of Health in Miami-Dade.
Erica.
Hi.
Hi, Janice Evans with the Missouri Department of Health and Senior Services.
Hi, Janice.
Hi.
This is Chelsea Arnett with St. Louis Upper for AIDS in St. Louis, Missouri.
Welcome. We had a little bit of an overlap there, but welcome both.
Hi, Eric Garcia, St. Louis City Department of Health.
Good afternoon, Darío Jiménez, case manager at for
Hi, Patti Serrato from Santa Clara County Public Health Department.
Hi, this is Laura Donasterk from ABCD Health Services in Boston, Massachusetts.
Hey, Laura.
Hi.
Hi.
Eddie Orozco, Freelance Youth Services, Miami.
Welcome.
Hi, this is Ricardo Barnick from the Georgia Division of Public Health, STD section.
Wonderful. Thank you.
Hi, my name is Sylvia. I'm a student at Tulane University Public Health Education, New Orleans.
Oh, great. Thanks for joining us.
This is Edwin Espinel, Utah Department of Health.
Hey, Edwin.
Hello.
Good morning, good afternoon. This is Javier Rios. I'm with the New Mexico Department of Health, Office of Health Equity.
Hey, Javier.
Hi, good afternoon. This is Pedro Rodriguez from New York City Gay Men's Health Crisis.
Hey, Pedro. How are you?
I'm good, and you?
Good, good.
Good afternoon, Desiree Ortiz from Keystone Health HIV Program in Chambersburg, PA.
Hey, Desiree.
Hi. Hi, Eric Garcia, St. Louis City Department of Health.
Eric. And we also have Alfredo Hernandez Chavez with EDC in Boston. We have Jasmine in Atlanta with CDC. Diana Curto in Washington, D.C. Randy Viel, the 8th Council of Northeastern New York and Albany. Marcelo in ACT UP, New York. Efren in the 16th Street Community Health Center in Milwaukee. Gregory, the Philadelphia Department of Public Health. Michelle and from the AIDS Institute in Tampa, Florida, and Washington, D.C. Desiree, which I think she just introduced herself a minute ago. Catherine with the Wake County Human Services in North Carolina. Eddie Orozco with the Youth Services in Miami. Sara, the Public Health HIV Prevention Program in El Paso, Texas. And Abel in the Florida Department of Health in Tampa, Florida. Anyone else want to introduce themselves on the line?
Yes, this is Javier Ortega from Santa Barbara, California.
Hey, Javier, how are you?
Pretty good, thank you.
This is Luis and Darío Jiménez from A4H here in New York City.
Wonderful. How are you doing, Luis?
Good. Good afternoon. This is Emilio Herman from CDC in Atlanta.
Hey, Emilio, how are you?
I'm good. How are you?
Good.
Good afternoon. This is DeWanda Waller from CDC in Atlanta, Georgia.
Hey, DeWanda. Thanks for joining us.
Good afternoon. This is Garrett Jackson from Penn Good & Associates.
Hey, Garrett. Anyone else? Great. So as you all can tell, we have a good number of people on the line with us from all over the country. Thank you guys for taking the time for joining to join us this afternoon. This will be a pretty brief call, about an hour or so, but I think the information we'll be discussing is very beneficial to kind of give us some insight as far as how the campaign went last year, and this will really help us with planning for this year's campaign. So we look forward to hearing your comments and your ideas and your feedback after you present this information, so that we can kind of use that information then to integrate into the implementation of the 2014 NLAAD campaign. So we look forward to having you guys on the call and provide your input on what we talk about today. As you can tell, when the lines are unmuted, to hear at times because there's some background noise in some of the calls. So what we tend to do is put the lines on mute. But again, if you want to make a comment, you can do so by dialing or unmuting your line, and you can do that by pressing *7, and then you can mute your line again by pressing *6. I'd recommend go ahead and using the chat function throughout the course of the webinar. There will be parts of the webinar where we'll go ahead and unmute the lines, just so we can get your comments and your questions and make sure we have the lines open for everyone to kind of have a discussion. So what I'll do again is I'll go ahead and mute the lines now.
The conference has been muted.
So again, that's going to help with eliminating some of the background noise. So I'll do a quick brief introduction for those partners that are on the call that haven't been involved with NLAAD previously. National Latino AIDS Awareness Day takes place every October 15th. It was an initiative that was started by the Latino Commission on AIDS, and it's very much a grassroots movement, meaning that more so than just putting out messaging out there, we really rely on a collaborative effort to make sure that the campaign is beneficial nationwide. One agency, one group cannot make sure that the general communities in the grassroots level, at the local level, could really raise your awareness. So we really do rely on a collaborative effort and working with each other to make sure that this marketing campaign builds itself up and really helps with the general awareness of the Latino community when it comes to HIV and AIDS. The campaign is over 10 years old now. It was first started back in 2003. And as you can see, there's a huge collaborative effort that takes place in hosting local events for National Latino AIDS Awareness Day on and around October 15th. The themes change from year to year depending on the information that we kind of gather from the campaign previously and the input that we get from partners. We really want to make sure that we capture and understand what's going on locally, knowing that different regions have different needs as far as what awareness means, right? So awareness in the South might mean general HIV information, where somewhere like in the Northeast, it might mean more about general awareness about testing and where to get tested. So it really does change depending on the region. And we'll talk about how we try to address that in the implementation of NLAAD last year. So again, the National Latino AIDS Awareness Day is a program that's spearheaded by the Latino Commission on AIDS from year to year, and it's a collaborative effort with partners across the country like yourselves. And partners can be anyone from a church group to student groups to an organization. So we really do encourage, no matter what your affiliation is, to get involved with National Latino AIDS Awareness Day in one way or another. Oftentimes some of the most effective partners or very useful partners are those partners that we oftentimes don't think about partnering with. So we really do encourage community-based organizations to think outside the box and really do go out and reach out to new partnerships and develop local collaborative efforts with student groups, with faith-based organizations, with local businesses and things like this. And we'll talk about how the general campaign tries to produce information to you all to be able to do that in a minute. So NLAAD 2013, these are some of the highlights that I want to go ahead and make sure we mention. And this information is pulled directly from the report that we produce every year. What I'll go ahead and do after we go ahead and at the end of the presentation is I'll go ahead and mail out the actual report that's produced that we pulled this information from to create this PowerPoint to you all to have. I really encourage you to read some of the details in that report because it's very beneficial as far as planning your NLAAD event or finding more about how NLAAD is implemented and how NLAAD does what it does from year to year. Last year's theme was Commit to Speak, and again the theme was more of a call to action last year. We really found out from the report that was produced in 2012 that most people do something about NLAAD when they hear about it from other people that they know. So understanding that the word of mouth is a big piece as far as increasing awareness and getting people to do something. And in response to National Latino AIDS Awareness Day, we really crafted a message that spoke to that with the help of our Leadership Council. And we'll talk a little bit about who the Leadership Council is in a minute. So last year's theme was Commit to Speak. And here you'll see a general timeline of the things that were done as far as the campaign itself nationally. And then we'll also talk about what partners did locally in a minute. So again, the theme was announced around May after or during the calls that we had with the Leadership Council. And we produced several items in response to that theme, like the posters, where we had different images of different local leaders and different figures in the Latino community that really spoke to the needs, or kind of the figures that people really respected, or people that related to the Latino community in a way that we felt would really help with emulating what talking or the importance of talking about or committing to speak about HIV would look like. We also produce something that's called the Campaign Kit, which is a series of resources. In the Campaign Kit, which is available electronically on the website, you have things like fact sheets about different segments of the community, the Latino community, and how they're impacted by HIV and AIDS. So we have things like, Latino youth and HIV and AIDS, men who have sex with men in the Latino community and HIV and AIDS, women and HIV and AIDS, intravenous drug users, Latino intravenous drug users and AIDS, or HIV and AIDS. So the impact of HIV and AIDS within these different segments of the community. On top of that, we also have resources in the Campaign Kit. And the resources are more about helping partners organize events. So you'll have things like how to write a letter to a local business to kind of get support, or how to craft a proclamation to send to an elected official to get some sort of, to get them to proclaim, October 15th as the National Latino AIDS Awareness Day locally. How to craft a PSA, how to write a radio announcement. So it's a very useful campaign kit, and it changes from year to year based on the input that we get from partners as far as what they think would be useful to have in it. So again, we really want to make sure that we get your feedback to make sure that we produce the information that you're looking for that would be beneficial, not only in following webinars, but also the content that you produce in the campaign kit. Something new that we also did last year, as you'll see, is we had a series of different webcasts. And webcasts are different from calls like this or webinars in that it's a live video panel. So we invited different people from different segments of the community. So we had one webcast where it was a live video stream of us having a conversation around how queer Latinos in HIV and AIDS. Another one where we had one around general Latinos and HIV and AIDS on the actual date of National Latino AIDS Awareness Day. We had one on the faith-based community and faith-based community and HIV and AIDS, how they can get involved. There was the importance of faith-based organizations getting involved with raising awareness. We had one on healthcare providers and Latino HIV awareness. And we'll talk a little bit more about what street intercepts are, and also this online partner survey, which both really help craft the report that we produce every year, right? And another thing that we do every year is we have a press conference on the steps of New York City Hall, and we also, something new and innovative that we really pushed to do was the launching of the National Latino AIDS Awareness Day website. And a lot of new social media streams that we hadn't produced before that we thought would really be beneficial when it comes to a theme like committing to speak, right? So that looks like the Instagram page that we have here, where we at the United States Conference on AIDS, USCA, we asked people why they commit to speak, and we produced an Instagram page around why people commit to speak, and prompted other people to produce the same thing. And we also created the website, which you'll see on your screen now. Hopefully you should be able to. It's a new website, and there was a bit of a learning curve as far as how to use it, but it was very innovative in the way we were trying to produce information, especially during a time where we're trying to go more green and make sure that we have resources available to partners online so that they're ready to use as soon as possible. So you'll see that you can log in once you've registered as a partner on the website, and once you've logged in, you'll be able to access things like the campaign kit and also publish your event, so other people can know about your event and what's going on. So all these tools were really useful in making sure that we implemented the campaign in a new, effective way. Now what I'm going to go into is kind of talk about things that were different, along with some of the social media stuff we just talked about. We created last year for the first time what we call the National Latino AIDS Awareness Day Leadership Council. And the Leadership Council was comprised of different representatives from different regions. And we did this, and we developed these regions based on local Latino HIV prevalence data, and also we looked at existing partners that we had in these regions. And we overlap this information, and from this information we produce these different regions. And we invited people that have been involved with NLAAD for a very long time, or a couple of years, to be part of this leadership council to really help us develop the campaign and the way it's implemented every year. So we'll talk a little bit about how people can participate in the leadership council in a minute. But again, there were 8 regions: the Western region, the Mountain region, the Central Midwest region, the Midwest region, the Northeast region, the Southeast region, the Caribbean, and the Southwest. All in all, those were 8 regions. We had 30 Leadership Council members from all these regions, and we hosted 3 Leadership Council calls where we got feedback from the council as far as what they felt would be useful to implement and integrate into the campaign that year. And that's pretty much where we got things like the theme that year, last year. We also got different things that they felt should be included or kept in the campaign kit, and also different information as far as how the website could be redesigned, or how we can engage local partners to be involved with NLAAD. So we'll announce a little bit more details about the Leadership Council and how people on the call now, if you're interested, could be involved with the Leadership Council at the end of the call. So part of what we do from year to year, in order to capture some of this reported information, is we produce, like we said, a report. And from this report, we also captured from the website different things like what people were actually downloading from the website and using. And we noticed that people we generally considered, even though there were several glitches, that the website was a general success. And that's because we had a 53% increase in visits and new volume of visits after the redesign of the website was launched. So the fact that there was such a heightened use of the website, we felt that spoke to the success of the website. So we found it very, very, we were very pleased to see that information come up. Once we looked into more data from the website, we saw that there were 3 main things that were being downloaded as far as the campaign kit goes. The thing that was downloaded the most was the fact sheet on general Latinos and HIV/AIDS, followed by HIV/AIDS and Latino youth, and HIV/AIDS and Latino men who have sex with men. So again, those are 3 of the fact sheets that are found in the campaign kit. And we find this information very useful because this will let us know this information we want to make sure that we keep in the campaign kit and make sure we put the effort into revitalizing and using new information to include in those, because we know those are the information that people are going ahead and using. So the way in which this report is generally produced is some of you guys might have even participated in this, is we have an online survey for partners that were involved, and also people that were part of organizations or groups that hadn't participated in NLAAD before or that year, just to make sure that we capture to see what's going on with NLAAD or why people didn't participate in NLAAD if they have heard of it. And this information is very useful for us, again, to craft things like this report to help us plan for the following year. With that, we had a total of 129 partner or organizations complete the survey. 54% of those were community-based organizations, 11% were clinic-based, 8% were Department of Health, 8% were academic institutions, and 19% were other. What we'll see is that oftentimes we have partners that register for the website or don't complete the online survey, which really gives us a gap of information. So which is why we really encourage, and you get a lot of emails at the end of NLAAD, which sometimes after the implementation of National Latino AIDS Awareness Day, we don't want to think about NLAAD for a while, but that information is very useful for us to craft this information so that we can give it to you all and then implement the following year's campaign and use that information to really make sure the campaign is successful from year to year. From the people that registered, we had 102 organizations register on the website, and they registered 148 events. And again, we acknowledge the fact that not all organizations, just because the campaign's been around since 2003, that's over 10 years that the campaign's been around. Organizations or groups don't always register their events because maybe they've forgotten, or they figure that they're still registered even though they didn't register for that year. It's very important for organizations to register from year to year, just so we can make sure that we're maintaining communication with organizations that are involved with hosting events locally. So I'm sure that even though we say there's 102 organizations, that's the number of organizations that register on the website. I'm sure there were a lot more organizations that were involved with the implementation and development of a local NLAAD campaign or event, but this is what we've captured from the registration on the website. So even though there's 102, historically there have been years where we've had over 200 and some odd organizations across the country, and also in the territories like Puerto Rico, the Virgin Islands, and things like this, where that number is usually a lot higher. And again, we're attributing that to the idea that, you know, a lot of people are not registering the website so far because of the glitches, but also because we're also seeing a lot of collaboration going on across the country, which is great because that's what we want to see. Especially during a time where we don't have as many resources as we've done before. We're seeing a lot of more organizations and groups collaborate with one another to host these events, because that'll put more resources in hosting, you know, larger local events rather than having a series of smaller competing events within the same general area. So we do encourage organizations to go ahead and collaborate in hosting local events. So what do these events look like? From the online partner survey, we saw that organizations, about 51.7% of those, hosted a health fair, 34.5% hosted information dissemination, maybe they're passing out flyers, put up some of the posters that we produced, 22% had a cultural event, 22% created a PSA or had some sort of social media aspect, 90% had a local discussion, so maybe they had a group discussion that they hosted within a program at the organization. 6.9%, this is something that's very innovative, is we found that 6.9% hosted a skit, so some sort of performance or performance piece to raise awareness. Other organizations did a press conference and things like a candlelight vigil. So as you can see, especially for partners that haven't registered or been involved with NLAAD before, it doesn't always have to be a testing thing. A lot of groups end up hosting events where they don't supply testing there, but they can refer them to other locations to get tested, which really speaks to the fact that NLAAD is an awareness campaign, and awareness can look very different depending on where you're located and what you're looking to deliver. But again, NLAAD is traditionally a testing campaign because we have seen that Latinos find out they're positive or their status at a very late stages of the disease, which is one of the major reasons why we initially developed the campaign, was to combat that. Because we know that, especially now, the sooner someone finds out their status, whether they're positive, and get into treatment, it really helps with prolonging their life and making sure that things are in order. So, again, you know, don't think that because you're not a health service organization or a health group, if you think things like a fraternity group, that you can't do something for National Latino AIDS Awareness Day. You can see that there's several things that you can do to get involved with hosting an event at the local level. Marcela asks, I'm having problems with such an Marcelo, you said you're trying to access the website. It's www.nlaad.org. So maybe try adding the www in front of the nlaad.org. Another way in which we capture information is we really want to understand how what we're doing, the events that we're producing, the campaign that we're kind of trying to give a national awareness about, how that's doing. So we do this by doing street intercept surveys. And what street intercept surveys are is that we collaborate with local partners, and they go ahead and conduct these short street intercept surveys, approximately 50 before National Latino AIDS Awareness Day and 50 after. And by using that information, it captures things like, have you heard of National Latino AIDS Awareness Day? If you have, what'd you do about it? If you haven't, have you gotten tested? So it really captures a lot of data about what the general community has heard about National Latino AIDS Awareness Day. And this really helps us input information in the report as far as what the community knows about National Latino AIDS Awareness Day and how effective the work that we're putting into producing these events locally are doing. So the data that we collect through the leadership surveys is really, in part, a huge undertaking as far as our local partners that decided to support us in doing that. So you'll see that there's different cities. It's not that we randomly selected to opt out, your local city, but these were cities where organizations volunteered to conduct street intercept surveys so that we could collect this information and find out how NLAAD is doing locally. So these cities sometimes change from year to year, but there are certain cities that we capture all times, which is Atlanta, D.C., and New York City. So those 3 cities are cities that we've had partnerships in, where we collect leadership surveys and produce how the campaign's doing at that level every year. So we'll see from those cities, one of the questions was around whether they've heard of National Latino AIDS Awareness Day before. As you can see, there was different levels of awareness in all those cities, and we captured this information again from those leadership surveys. So we want to know whether people have heard about National Latino AIDS Awareness Day, and these are community members, so these are people from the community, not affiliated or not a partner. These are people that are from the community to try to find out whether they've heard of National Latino AIDS Awareness Day and what they've done in response to the campaign. So from the people that have heard of National Latino AIDS Awareness Day, we asked them where they heard about National Latino AIDS Awareness Day from, and again, the majority of people have heard of the campaign or heard of the Awareness Day because of the work that the partners are doing, so from organizations. So 26% of the people that said that they've heard of National Latino AIDS Awareness Day said they heard about it from an organization that was doing work locally. So that speaks volumes to the work that we're doing as far as our partners locally. 22% said they heard from it from word of mouth, which I think speaks another great success as far as the effectiveness of the last year's campaign theme, which was Commit to Speak. So the fact that a lot of people heard about National Latino AIDS Awareness Day from word of mouth lets us know that that theme was really a great success as far as letting people know what National Latino AIDS Awareness Day is and the importance of speaking about HIV and AIDS locally. So we'll see some of the other things that were followed by that were TV, the event that was hosted locally by partners, posters, radio, Facebook, so again social media, and newspaper, right? So these are the places where people heard about the campaign from. We also want to know, yeah, you've heard about the campaign, but what did you do in response to the campaign, right? Because that's a big piece. This is the meat of the campaign. We want to make sure that people do something in response to knowing about HIV and AIDS. So 23%, about 22% of the people that had heard about NLAAD last year took an HIV test. And this is great. This is what we want to see. This is followed by talk about HIV with friends, attended an NLAAD event, talked about HIV with family, increased use of condom, talk about HIV with a partner, and then talk about HIV with a doctor. So again, some of the larger pieces were really about talking about HIV, but the highest was taking an HIV test, which is great. Our partners have historically done a great job. We have a great positivity rate as far as we're finding with organizations that offer testing at their events. Last year we saw a 3% positivity rate amongst organizations that did testing at their events. So that's again the reason why during the online partner survey we asked you whether you provided testing, and then we asked you for those numbers because you want to see how effective we're doing nationally as far as the implementation of the campaign. So we thank you for providing us information, because sometimes I can tell that could be very difficult information to gather and present again, but it really does help with letting us know how effective the campaign is. Another useful piece is understanding what type of referrals people are getting from these events, right? So we captured these referrals both by HIV positive and HIV negative individuals. So we'll see that the majority, what that looks like, there was referrals for domestic violence, needle exchange, substance use, legal services, mental health, food pantry, medical referrals to a medical provider, which is a key component, especially if we're talking about linkage to care, case management, STD clinic, and health insurance, right? So this information, again, is very useful for us to kind of understand what's going on depending on the person's HIV status and what they're being referred to. And again, I present this information to you because I think it's going to be beneficial as far as the type of things that you want to go ahead and address, maybe locally when you're hosting these events. So with all the information I just presented, there's 10 key takeaways that I want us to understand before I open the lines up for questions and answers and comments. The first one being is that over 33% of the surveyed community members were aware of NLAAD. This is huge. That 33% of the people that were surveyed were aware of NLAAD. That's a wonderful thing. especially with most social marketing campaigns, that a number like that is usually very unheard of. 26% of those surveyed in the streets noted that they had heard of NLAAD through local organizations. Another 22% had heard of NLAAD through word of mouth. So those, again, great highlights to know where people are hearing about NLAAD from. Of the community members from the Street Intercept survey respondents that indicated they had heard of NLAAD, slightly over 28% noted they did something in response to the campaign. So the fact that about 28% of people that had heard the campaign had done something about it, again, speaks to the success and work that we're all putting into implementing NLAAD every year. Over 76% of community members who had heard of NLAAD had at some point in their lives been tested for HIV. Another key point, especially when it comes to understanding that Latinos are traditionally late testers. Of our partners that completed the online survey, so again, this is a survey that's conducted only to partners that hosted an event, or maybe people that were part of an organization but didn't host an event. Of those people that completed that survey that held an event, close to 52% held it or participated in a health fair. Nearly 83% of those that held an event conducted HIV testing. And again, NLAAD is a huge traditional HIV testing campaign to address the fact that Latinos are late testers. Number 6, of those that had offered HIV testing at the NLAAD event, close to 36% know that they did so in order to align with CDC's High Impact Prevention Initiative. This is great because it's letting us know that organizations understand what's going on nationally, and they're trying to do things like engage in National Latino AIDS Awareness Day, which is a high-impacted community, to address the National HIV/AIDS strategy and align itself with the High Impact Prevention Initiative. So NLAAD is a great way for partners to align itself with the changes that are going on nationally. As for our partners who completed the online survey, approximately 2,000 individuals got tested. So we provide HIV testing campaigns thanks to the collaboration and sponsorship of OraSure Technologies. We provide some of the organizations that host testing events, we provide them with free testing kits for those events because of our partnership with OraSure, and about 2,000 people were tested from those testing kits donated by OraSure. 42.9% of partners made referrals to health insurance enrollment when the individual tested positive. When the individual tested negative, a larger percentage of our partners, 46.6%, made referrals to STD clinics, and that kind of speaks to co-infection. Partners who held an NLAAD event noted higher level of awareness of national policies, such as the Affordable Care Act, National HIV/AIDS Strategy, and High Impact Prevention than those that did not hold an event. So again, it really does speak to the fact that some of the resources we produce and information we provide help organizations understand the importance of being involved with things like National Latino AIDS Awareness Day, because it does assist with aligning organizations to address the needs of Latinos locally, which is a great, large piece of the National HIV/AIDS strategy. And something that I think we could do a better job at doing, because we honestly and frankly haven't been reaching some of those numbers as far as what the National HIV/AIDS awareness strategy was trying to have Latinos be at when it comes to meeting objectives. So there's still a lot of work to be done, but with that there's room for growth. So I encourage you all to get involved with NLAAD and find out how it can support you with your endeavors to get aligned with things like NHAWS and high impact prevention. Those who planned their NLAAD event 6 months prior to NLAAD taking place rated their success higher than those who planned their event less than 6 months prior. This is a given. I think this is closely tied into the fact that most people that plan an event 6 months ahead of NLAAD have been returning partners, so they have that experience of planning an event previously. So they know that sometimes, especially a larger scale event where you're engaging a lot of local partners, takes a lot more time. And they're putting in 6 months worth of collaboration and work to organize these events. Although the majority of our partners we saw generally start planning their NLAAD event about 3 months before NLAAD. So I want to close the sharing of information that we found from the report by thanking our partners. I want to especially thank the Centers for Disease Control for their continuous effort and involvement with National Latino AIDS Awareness Day and support annually. PennGood for understanding the importance of our work and supporting this creative endeavor, and especially Tony, Flavo, and Orchard Technologies for their continuous annual support with the donation of testing kits. And again, they donated 14 testing kits for us to give out to organizations that host events locally. Followed by, I want to thank those partners that went ahead and supported with conducting street intercept surveys. That's the Association for the Advancements of Mexican Americans, the El Paso Department of Health, Farm Worker Justice, Fundación Latinoamericana de Acción Social, Santa Barbara Neighborhood Clinics, and Neighborhood House. So these partners were the ones that helped us conduct those street intercept surveys to make sure that we understood how NLAAD was doing locally within those cities that they conducted the street intercept surveys. And finally, I want to thank the NLAAD 2013 Leadership Council, and you'll see their names here listed along with the organizations. And those are the 30 individuals that supported with the development of NLAAD for last year and really helped us craft things like the theme and help us realize what was going on locally so we can integrate that in the implementation of the campaign from year to year. So I want to thank those 30 individuals that are listed there that were involved with the Leadership Council. With that said, I know I'm speaking really fast and I'm a little bit out of breath now. I want to kind of open the lines now and welcome you all to give us feedback and ask any questions that you might have as far as the information that we just presented or your involvement with National Latino AIDS Awareness Day. So I'm going to go ahead and unmute the lines.
The conference has been unmuted.
And you can, even though the lines are muted, you can go ahead and make your comment or pose your question on the phone, or you can also type it into the chat box. So the lines are currently unmuted, so go ahead and talk or ask a question if you want to right now.
Don't have a prayer.
Your church is about to play matchmaker.
Javier just asked when we can start registering our events. Again, the purpose of us holding this call right now is to get your feedback so we can start developing the tools that will be uploaded to the website. So we expect that the website to be open for registration sometime around July. And again, that's because we want to make sure that we craft enough information and get your feedback to produce content that would be useful for you to have on the website. So you can start registering your event and registering on the website sometime in July. So expect that. Thanks for your question, Javier. Anyone else? So Dana asks, how can partners better encourage or recruit local businesses who want to promote NLAAD this year? A very good point, and I think something that we try to address annually with partners, and I think that can lend itself to a follow-up conversation or a webinar that we can have as far as how partners can engage local businesses to get involved. So I'm going to make note of that, Dana. That's very good feedback. As far as an interest, and maybe I want to see if other people might have the same interest in finding out how businesses can get involved or how organizations can engage local businesses. But a way in which we've tried to address that in the past is there's information in the campaign kit as far as a letter to a local business that outlines what NLAAD is, what you might be looking for as far as their involvement. So that's something that we try to incorporate in the campaign kit for partners to use to try to engage local businesses. But I think it also might be beneficial for us to host a call or webinar specifically on engaging local partners that haven't been involved and how to get them involved with NLAAD this year. So thank you for that comment. Does anyone else have any other comments or questions? Ricardo asked, how do we contact members in particularly city, for example, Atlanta, to collaborate on events? So one of the benefits of us having these calls is because it's for us to understand who's on the calls, and that's why I wanted to make sure that we had a time in the beginning for us to introduce ourselves so that we can see who's already involved with National Latino AIDS Awareness Day or has an interest, because we do have a very expansive or very extended network of partners. We have over 200 partners that are existing already, and once you register on the website, you can see who those partners are. So that really helps with other organizations that are already thinking of being involved to see who's locally already hosting an event to encourage collaboration across those organizations. So I really do encourage partners to register because it lets you know, it provides you as a contact person for other organizations to reach out to collaborate in hosting these events. Eddie asked, can there be a collaboration with local community agencies? Of course, again, what we want to encourage, especially during a time when resources aren't as plentiful, is for organizations to collaborate. We want to make sure that partners collaborate with each other to produce maybe larger events rather than hosting combating events that might affect the outcome at your local event. So we do encourage collaboration across agencies, across different groups, and I think that's something that we want to see more of and the community to see more of this year. Michelle asked, is there a 2014 proposed theme, or will that be decided from the leadership? That's something that's decided from the Leadership Council. So again, the purpose of this call is to kind of provide you with information that we've gathered, and that's something that we'll discuss with the Leadership Council once we've received some general interest in that, to produce information like the campaign kit and the theme and any other changes that we might see for this year's campaign. Janice Evans asked, any best practices for engaging the community? So again, that's the same question that I think, who was it just asked? Dana just asked as far as engaging local partners, local businesses. I think that's something that we might want to discuss as a potential following webinar. And I'll talk in a minute about something that I think a lot of organizations underutilize as far as a service that we provide to the Latino Commission on AIDS, and that's capacity building. For those of you that are not familiar with capacity building assistance, that's something that the Latino Commission on AIDS is currently funded to provide to community-based organizations to help them in the realm of either HIV testing or prevention with positives or organizational infrastructure and program management. So within the Capacity Building Assistance Division, we can help you as far as increasing the effectiveness of collaboration for your testing as NLAAD is enrolled. Just because that's one of the components in which we can support you in. So we can assist you on how to do that and host meetings where we can provide capacity building assistance so you can go ahead and increase the awareness of your testing event for the sake of that. So I really do encourage organizations to utilize capacity building assistance and contact me directly if you're using that for the purpose of National Latino AIDS Awareness Day, because I would love to come out there and support you all in doing that, okay? Javier Ortega asked, it would be great if you guys leave us a space on the poster so we can add our logo or event. We do, Javier. That's the reason why if you saw on the poster, there's a blank spot at the bottom, and most people sometimes think, oh, that looks kind of weird that there's just a blank spot between the theme and where the bottom where it shows the sponsors. That spot right there is for you guys to handwrite or stamp your logos and put the information for your events right there. So that's the purpose as to what that's there for. One thing I want to do this year is I want to make sure that since the poster is being offered electronically online, I want to have the PDF version so you can enter and type in your local information so you guys don't have to handwrite it. Elvira asked, could you tell me how can have, we don't offer the HIV testing kits until we get closer to National Latino AIDS Awareness Day. And again, something I want to make organizations make note of is that I know, and this is great because we do want to provide testing to anyone that needs it. The testing kits that we have that we get donated from Oversure are strictly supposed to be used for National Latino AIDS Awareness Day events. And that's because we want to make sure that we have enough, because we only have about 4,000 testing kits. And as you saw, there were 4,000 donated, but only about 2,000 of those were used for a National Latino AIDS Awareness Day event. We have a limited amount of testing kits, and we want to make sure that as many organizations get those testing kits as possible, which is why we're asking people to make sure that they're using these testing kits that we get donated from Oversure for National Latino AIDS Awareness Day. So again, those will be available closer to National Latino AIDS Awareness Day. We usually have those available around August to give us sufficient time to have Oversure deliver them to you. And again, in order to receive these testing kits, you have to have a clear waiver ID number, which we ask from you when you're placing that order. So we do have testing kits available for organizations that request them that are having testing events for National Latino AIDS Awareness Day. So because, again, those numbers are limited as far as the number of testing kits that we get donated, we are asking organizations to make sure that they're using these testing kits for National Latino AIDS Awareness Day. Okay? Garrett asks, how should local businesses be approached as we begin marketing for Awareness Day? So that's the third time someone posed that question. So again, I want to say that we generally have tried to address this through organizations using the campaign kit, especially the resource section, because the resource section is where they have things like how to write a proclamation, how to write a letter to a local business, so it gives you a template where it describes National Latino AIDS Awareness Day and potential ways in which that business can engage and be involved with National Latino AIDS Awareness Day. Because that comment's been made 3 times, I'm going to go ahead and make note of the fact that I think this is going to be a good topic for us to have during a follow-up network call, because I think it'd be very useful for organizations to get that information as far as how to engage other partners and also businesses to get involved with National Latino AIDS Awareness Day. Nubia just asked, who does the testing at the events? So for organizations, especially groups that don't provide testing kits, sometimes we have student groups, and student groups don't have the capacity to provide testing. Those situations are situations in which we encourage organizations to collaborate with the local community-based organization that offers HIV testing. So we can provide organizations that don't provide testing from our list of partners, organizations that provide testing. So let's say you're in DC and you're a student group and want to make sure that at your university setting NLAAD event want to provide testing, we would link you or give you information or contact information to a local partner in DC that offers testing for you all to collaborate with. And again, we really encourage collaboration, and we want us to use this platform to let each other know what we're doing locally, and also for us to network with one another so we can support one another and create more of a collaborative effort when it comes to the implementation of National Latino AIDS Awareness Day. So again, collaboration, collaboration, collaboration. I've said it about 1 trillion times during this call, but I think that's really the key success, the reason why we've had such a great success with NLAAD every year so far. Are there any other questions anyone want to pose on the line or type into the chat box before we close the call with announcements? Great questions, by the way. These all have been great questions and have given us some great insights so far. Anything else? Roy just asked, when will the theme be determined? So again, the theme will be determined after we convene with the Leadership Council. In the Leadership Council, you'll see in a minute. Let me jump into that now then. That's a good segue. Thanks, Roy. As far as announcements go, I'm inviting you all to let me know whether you want to be involved with the National Latino AIDS Awareness Day Leadership Council. I kind of talked about it briefly during the course of the webinar today, but the role of the Leadership Council is several things. It's to identify local issues, so to let us know, we want to understand what's going on locally. So we're based in New York City. We have staff members from the Commission in North Carolina, but we want to make sure that we're understanding what's going on from our partners in their local regions. So part of what the Leadership Council does is it helps us understand what's going on locally to make sure we integrate those try to integrate those local issues in the campaign. We also use the input of the Leadership Council for the development of the campaign itself. So part of that has to do with the theme selection. So last year's theme, Commit to Speak, was selected by the Leadership Council. So once we convene with the Leadership Council is when we'll go ahead and discuss the theme, go over some of the information we discussed today, and come up with some ideas for the theme this year. So again, we expect to have the first NLAAD Leadership Council call sometime within the next month, where we'll discuss some of this information and expect the theme to be solidified sometime at the end of June, around the time when the website is going to be relaunched and open for registration. The Leadership Council also assists with partnerships. Generally, NLAAD Leadership Council members are partners that have been involved with NLAAD in the past or have very strong ties to the community locally and have a lot of an expansive network. People like this are considered great potential partners because they can really help pull in different people from their respective regions that sometimes not everyone, especially not us at a national level, have a direct connection to. So that's another way in which Leadership Council serves its purposes, kind of help create more partnerships and kind of expand other organizations and groups to get involved with the hosting of events. Another way is to increase awareness among partners and stakeholders in your region. And this is the area where I'm going to pitch, again, capacity building assistance. National Latino AIDS Awareness Day is a testing initiative, and it's something that we are integrating within the Capacity Building Assistance Division, and in that it's a testing initiative, and it really helps organizations increase their positivity rate. It's innovative, it's different, and it's really scalable, which is why we offer it as a model for other organizations to use and create partnerships with other organizations to really identify high-risk populations and use it as a way to test those individuals in a way where oftentimes we're not seeing. So it's a very innovative way in which you can get involved. And then the reason why it's a program under the Capacity Building Assistance Division at the Latino Commission on AIDS. Again, because of Capacity Building Assistance Division, we can offer you support around how to better implement your event for the sake of increasing that testing initiative. So that part of that could be around assistance with engaging other organizations and other groups where we'll come to you completely free of charge to provide you that assistance. So if you're interested in capacity building assistance or want to know more about it, go ahead and shoot me an email. My contact will be at the last slide. And with that said, are there any last comments before we close the call? I'm going to ask you all to go ahead to again complete the evaluation to give us more data, because of course the data we have enough isn't enough, but we really want to hear things like everyone's been discussing about how to engage local partners and local businesses. You can input that information in the evaluation survey and let us know what you thought about what we've discussed, whether you thought it was beneficial, and other things you think you want to hear about or can make NLAAD better for this year. You'll do that by completing the survey at the end, and that's going to pop up on the screen that you'll see come up on your monitor at the end of the webinar. And even though we're closing the webinar for now, we'll be hosting one in the near future. And I encourage you all to reach out to me. Send me an email directly if you're interested in participating in the Leadership Council. And my contact information is here. My email is tochoa, that's T-O-C-H-O-A at latinoaids.org. So please contact me directly if you're interested in being involved with the National Latino AIDS Awareness Day Leadership Council. We encourage everyone from all backgrounds, student groups, churches, faith-based organizations, CBOs, health departments, anyone that would be interested in being involved with the implementation of the campaign to shoot me an email and let me know that you're interested in being involved with that. Because again, we want to hear from you and make sure that we hear your voice and integrate your needs in the campaign, so that the campaign speaks to the needs that are going on locally. And Nubia just has to get in order to collaborate as a student group for testing. We will just register on the website. You can register on the website, and once you register on the website, that's when you'll be able to see who else has registered. But we can also connect you with other organizations that are in your area that can provide testing. So Nubia, send me an email. We can talk about a little bit more about that, just because I feel like that's a very specialized need. I want to make sure that I connect with you one-on-one. Shoot me an email. We can talk about how we provide that assistance to you. Okay? Again, it's tochoa at latinoaids.org. Shoot me an email. Anything about the questions you might have had after the call, or if you're interested in participating in the Leadership Council for the development of this year's campaign. Okay? My number is 212-675-3288 at extension 337. So with that, here you go. Marcelo asked me to add my email to the website. It should be under the contacts.
It's not.
It's also on your screen right now, okay? Okay. Marcelo, my email, it's tochoa, T-O-C-H-O-A at latinoaids.org. That's T-O-C-H-O-A at latinoaids.org. If you can respond to the invitation to this webinar, that's my email too. You just respond to the invitation you got to the webinar, and that'll come to me. All right, guys. With that said, thank you all again. Again, my email is always available. That's generally the best way to reach me. And I'll try to get back to you as soon as possible. Sometimes, especially now with the unrolling of the campaign, it might take me a bit to respond, but I try to respond as soon as possible. Okay. Thank you all again, and I look forward to the implementation and development of this year's campaign. Take care, everyone, and thank you guys for joining me.